This is the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. Brought to you by Keating Dental Lab, a full-service, award-winning dental lab that is here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.
So, Dr. Crossland, first, I want to say thank you on behalf of everyone here at Keating Dental Lab for being truly one of our very best customers since the inception of the laboratory. And each business has a unique story about a challenge that they've experienced in the early days of operations. And for us, one week it came down to making payroll or making a phone call. And Dr. Rick Crossland came through for us when it mattered most. We would have most likely lost a lot of employees that week in the early days, and who knows if we would have survived. But whenever this man's needed a favor, and even though he's never asked for one.
Oh, I have.
That's okay. You don't have to put that in there. We can edit that out. But I always remember that kind gesture that you did for us, and really you came through for us like few would. I would say that it's far less than 1% of men, women, business owners, private owners would have done what you did for us. And I've told you, but I've told hundreds of our other customers throughout the years that we would not have this wonderful building if it wasn't for you and your selfless act back in those early days. So again, thank you. And with that being said, I'm pleased to introduce.
It was my pleasure.
Oh, thank you. But you're too humble. And with that, I'm pleased to introduce one of the very best dentists in the United States and my good friend, Dr. Rick Crossland.
Thank you. Thank you.
Thank you. So I know
your nose is growing a little bit when you said that about the good dentist part, but go ahead. Go ahead.
This is about dentistry. This is about dentistry. So we do have to talk a little bit about dentistry. It's not all business. So we're going to talk about business. We're going to talk about dentistry and a little bit about business. But why don't you tell us how you first came to be introduced to Sean and Keating Dental Arts? It was called Keating Dental Arts.
Are we allowed to mention competitors?
Yes, absolutely.
Okay. Well, Sean was a manager at Glidewell and got to know him very, very well. And he managed my cases, assigned me technicians, and he was you over there. When he decided to go on his own, it was everybody that I knew was going to the new facility, and it was just natural. We just got along from the get-go. There's never been any. I mean, if I needed something, he just does it. And if I ever had a question, or not every case is perfect. And if there's some reason I don't like one or it doesn't fit it, I would probably blame it on my impression or whatever. But not once in 20 years, or the whole time, probably closer to 30, have I ever heard one time Sean say, well, that wasn't our fault, or gee, it was always what can we do to make it better, and let's fix it. So when he moved over, I moved with him and been with him since day one and still there today.
Thank you so much for your loyalty. That's a tremendous statement, a tremendous testament to yours and Sean's friendship and loyalty. But also it illustrates an important point how we run this business here. And I know you and I have been through it many times too. Is what we're here for you, and we're here for your patients. And if we don't get it right, we will do whatever it takes to fix it. And I learned that from Sean a long time ago also, that, we need to.
And while we're throwing around compliments, you're a major factor. You've been awesome. You've been a friend more than you've been my contact at Keating. And I appreciate everything you've done.
Thank you. And I feel exactly the same way. You're more than just a dentist, more than just a customer. You are also my friend. And I shouldn't have choked up trying to say that, but I did. You're gonna make the rest of this really difficult, aren't you?
No, that's it. Okay. That was it.
All right. Wow. Okay. So let's go back, I guess, a little bit to the beginning, because when I first came to work for Sean, you were already his customer, and Sean sat me down and said, this is who we take care of. This is what we do, and this is how we do it. And I mean, can you remember those early days? I mean, I still remember the Bio2000s and everything. We remember that?
Yes, I do. Yes, I do. And we've come a long way.
We have
the Bio2000s and the Captecs and all of that. It seems like although that is how I went from Florida to Glidewell in the first place, because of their all ceramics and their Captec work. But still, the Captec, I think you didn't make them, but you stood behind them, and
we weren't allowed to sell them.
No, and you remade a lot of them. There was a lot of porcelain fractures, but the new stuff is just amazing.
Yeah. So let's go back a little bit for the younger generation. Tell us what Bio2000 and Captek was, just briefly.
It was a way to get a very, very, very aesthetic crown. You had a very, very thin layer of almost pure gold. I think, what was it, like 22 karat? If you were working in the jewelry business, it was darn near pure. But it was very technique sensitive also. On the X-rays, everything looked beautiful. The fit was beautiful. Everything was wonderful.
And the tissue reaction.
The tissue adaptation was fine. Its reaction to it was fine. Reacted everything like gold. I mean, it was beautiful work. Am I allowed to say it? It just didn't hold up like this stuff is now? Absolutely,
because this is about the evolution of dental materials. So absolutely, say it.
The interface between the porcelain and the gold wasn't great.
Wasn't the strongest.
Its bond strength wasn't that great. We had a lot of porcelain fractures, and they even used what was it, IDS or something like that, a porcelain on top of it. It was a different porcelain, but it wasn't what we're used to now.
Right. And then we kind of went into some of the early all ceramic families. I remember it was Empress and Empress 2, and then it became Heiress. And I think what you were about to describe was the Heiress.
Yes. Yeah. Where, what was it? They used a lower fusing porcelain after they cooked it and filled in around the margins. And my God, you could take the tooth out, that looked beautiful. But on an X-ray, it didn't look that way. It did not look good. But then when they evolved with a different core, and you're right, they went from Empress to Empress 1, Empress 2, Heiress, Emax, and now
and I think with Emax,
Zirconi.
Yeah, and I think with Emax they got it right. I mean, we still do Emax for you.
Yep, you do Emax for me. When it comes to a really realistic translucency that mimics natural teeth and looks more like the old feldspathic type of veneer, the Emax is that product. But even down to the early porcelain fused to zirconia, they were just too bright. I mean, the tone was fine, but the value was just too high. They were just too intense. But you guys have figured out a way to tone the cores and make them look so realistic that, you know the numbers better than me. I'd say that the porcelain, the zirconia is my bread and butter, even in the anterior region. We do a fair amount of Emax, but by and large, it's porcelain fused to zirconia.
Yeah, I was just going to go into that. I mean, that is your go-to material for your large cases, for your full arch and full mouth rehab cases is KDZ Ultras. So that's the porcelain fused zirconia. KDZ Ultras is our trade name here at Keating Dental Lab. We use the Noritaki CZR porcelain, which is a high fusing ceramic, and we can
the difference between that porcelain and using their zirconia core versus the original all ceramics where you had to use the lower fusing. I mean, I'm old. I've seen, 15, 20-year-old all ceramic crowns, and they have a graininess to them that you can see it. You can actually hear it when you run an Explorer across it, and you can just feel the difference from that Noritaki. The Noritaki is, your porcelain fused metal.
Correct. Yeah.
And it's so hard and so glassy, and it just doesn't break down. And you guys have it. Your translucency and your depth in those crowns are just amazing. They're just beautiful anterior work.
It is truly an amazing porcelain, and that's been one of the distinguishing factors of our laboratory. I mean, I remember, I think it was year 2 I was here, so this probably goes back 16 or 17 years when we made the switch from the Ceramco brand over to Noritaki. I mean, myself and all the technicians, all the ceramists, we saw the difference immediately, and we were so happy. And it was just, I mean, just their full palette of porcelains, and
actually can tell patients, porcelain doesn't stain, it's not bonding, da 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 da. But you look at stuff back in 04, 05, 06, and they have yellowed and they have stained because they are more porous and more grainy. The stuff we've been using since we switched to the Noritaki is night and day. Hard as a rock. I don't know. Marble, granite, I don't know. Glass.
It is. I mean,
it's very glassy.
Not only the bond strength, but just the strength of the porcelain itself really exceeds anything that I've ever used, on the bench ever. And, then you throw in just the sheer beauty of the Noritaki brand of porcelain. It's just, it's amazing.
For aesthetics, the old feldspathic veneers were amazing, but you guys have over a period of years gotten this Noritaki down pat, and it just, the aesthetics is just beautiful.
Thank you. I mean, that's
You're
really
welcome.
That's a
I wouldn't say it if I didn't mean it.
That's a testament to the skill level of our technicians. They dance circles around me in terms of their ability. It's really a wonderful group that we have here. And
but we're not using my guy's name on this.
No.
I don't want him overloaded. I like him.
Absolutely. Yep. We're not giving Dr. Crossland's team of technicians out to anybody, I promise you. So if you're listening out there on Dental Up and want to send us a case, I'll get you a good team. We've got plenty of good teams, but Dr. Crossland's team is full.
For a small fee. No, I'm kidding.
Well, that's negotiable by you on your side. Oh man. So now you've sort of switched a little bit again and gone into the monolithic zirconia family of materials. And tell us what you're doing now for your single unit posteriors.
Single unit now is and you're going to yell at me because I always call what I call them the Bruxer HT for high translucency.
Yeah.
Because the original zirconia crowns that we came back with, when they first came out with the full monolithic zirconia, it looked like chalk, and they did. Now that you're putting the lithium disilicate in them, it gives them translucency. They actually look probably good enough to use in the anterior, but I just can't give that up. I have to use my Bruxer. I mean my KDZ Ultras up there. I'm sorry, but they do look that good. And it's the fit. Thank God. I mean, I can't tell you how many times I've conned around with somebody and you put it in their mouth. They say, "Oh my God, it's perfect." And then I say, "Oh, no, here, let me," and I just touch the top of it for a second. And I said, that's because you need me. You can't just order these off of Amazon. So
you want to pretend like you're working.
Yeah, huh? I gotta look like I'm doing something there and earn a living. But no, they're excellent crowns. And why I call them Bruxer HTs is because I can't spell aesthetics. And I know that's the real name of them, but
it's actually easy for us too.
your lab knows me by now. Bruxer HTs, Ultras, and Crowneers, which we won't even go into that name.
No, we can go into that, but no, the Bruxer HT. I mean, I truly think now, just for the rest of the Dental Lab podcast world, what's your take on just the pure aesthetic component of the KDZ Bruxer Aesthetic, the Bruxer HTs, versus an Emax restoration?
Well, I guess the proof is in the pudding. I can't remember the last time I used the Emax in the posterior, because I just love the look of your Bruxer HT or your Bruxer Aesthetics. Mm-hmm. The translucency is beautiful. I love that hard core in it. I don't have to worry about. I've never had a crown chip or crack in all these years. I don't know how long you've been doing it, but obviously there's no porcelain added to it. It's kind of hard to chip porcelain off.
There's nothing to delaminate.
There's just no reason. I know that we're supposed to be using Emax and all that stuff back there, but so far the Ultra in the front and the Bruxer in the back is working well, and just hate to fix something that isn't broken. So
no, right,
I'm not fixing it.
Absolutely.
Every once in a while, if I have to do a case where I have to blend it in with existing veneers or try to match it in between natural teeth. We will go to the Emax in the front for that. Other than that, it's a KDZ Ultra and Bruxer HT kind of office.
Absolutely. And you touched on it. It's predictable.
Yes.
You know the end result, when you're prepping.
But I will say that your lab's porcelain infused metal is such a high quality that if I am doing something with, I know I'm not even getting paid for this. If there's something where we have a few ponics that I have to worry about, I still feel a little more comfortable with the longevity of the metal underneath. And you guys, I think what's carried over from the depth and the value in your porcelain infused zirconia, because you still have to block out that zirconia, because if you don't tone it or do something to it, it's pretty bright and it's opposite of the metal, but the theory is still the same. We got to make this crown look real, and we got to give it some depth and translucency and make it look, aesthetically pleasing. And your PFMs do that.
Well, that's because you prep with reduction in mind for the type of restoration you're prescribing. And a lot of times we get cases that are under reduced and we flat out can't do a PFM. It just would look bright and opaque, or the porcelain would be so thin that it would delaminate. But
it's funny, when we all start out, we were preached to, protect the nerve, protect the nerve, protect the nerve. And every young dentist, including myself, starts out, I think, on the tendency of under prepping those things instead of giving the lab enough room to work until you get into the Captec family. Then if you took too much off, then you had issues with too much porcelain. That stuff was really touchy.
Yeah, there was a very small window of reduction that was an ideal material. And, if you prepped it too thin, or under reduced it, or over reduced it, or didn't have a proper core on there, those are all the cases that failed.
I don't think I've done it. I know I haven't done a Captec since we moved over. I think I quit doing them even before I did move over, because I just saw too many fractures, too many failures.
Yeah. So let's go back. Let's go back to your crownier. That's a term that is it is trademarked by Dr. Rick Crossland from Clearwater, yes, Florida, and it's something that, again, I've used on, unbeknownst to you, but I've actually described your preparation style to many other customers when they've needed to really correct some, either crooked dentition or they wanted very minimal preps, but they were trying to close huge diastemas. So why don't you tell us about the crownier? It's your porcelain infused zirconia or your Empress. I mean, it's you tell somebody, veneer is an all ceramic product, and it is, but it's because in Clearwater, Florida, we have a lot of elderly patients, and their concept of a crown is the old bulky porcelain infused metal. You can tell from 30 feet away that it's a fake tooth and it's crown, and it turns them off. That you tell someone we're doing veneers, those are great. That's Hollywood, and that's usually when I throw in you guys are right outside of LA. But we're on the good side of LA, though.
So now, but yeah, exactly. But now we, just tell them that we take that ceramic product and we just wrap it all the way around the tooth, like a 360-degree veneer. So you can cement it conventionally, but you have to worry about it in a grinder popping it off, or after a few years seeing a cement seam, even in the back or on the gum line if the gum recedes or whatever. It's just a great crown, and that it gives them a better understanding of what we're putting in, and then you explain to them, less layers, and don't have to opaque out the metal and have to scatter layer and everything else in there, so you don't have to reduce as much, and they feel a little bit better about it.
Cool.
And I also tell them never tell anybody else what a crownier is, because they're going to get a look like they have no idea what they're talking about.
Right. Yeah. You're going to retire, and one of your patients is going to go to a different office, and they say, "Oh, Mr. Jones, you have a crown here." And it's like, "No, I got a crownier."
Yeah, got a whole mouth of crownier.
Yeah.
But it's been fun.
Cool. So tell us, we did an exciting case. I know we probably shouldn't use names, but I think in this case it's okay. Tell us about Frank's case and how it changed him.
Well, my brother is just a few years older than me, and I had to put that in case he ever sees this. No, but he needed his he really needed his upper teeth veneered. And I've been getting on him for a few years now and telling Frank, I'm going to be leaving. I'm going to be done. I'm going to be done. I'm going to be done. And I said, well, while I still own the office, we're doing your teeth. So we did. And it's a beautiful case. It came out absolutely gorgeous. I never realized that my brother just didn't like showing his teeth. He would laugh a little bit down and, put his hand up and stuff. And now he's an attorney. We were doing a Zoom meeting with him the other day. And I actually had this, okay, stop it. Quit smiling. I'm going to smack the smile off your face. That's all I do. He won't quit smiling. And he was reluctant to do the top. But as soon as we did the top, the glue wasn't even set yet. The cement wasn't set. And he's like, when we doing the bottoms? Like, are you kidding me? Give me a month here to recover a little bit. But yeah, he's thrilled. It's actually, it's changed his personality. He's 60 some years old, and you would hate to think that something at this stage could have such an impact on him. But he's a different person. He's so talkative, outgoing. As you can tell, might be a little bit more outgoing.
That's a brilliant statement right there. For a 60-year-old man to have a full mouth rehab and to smile and to not quit smiling and everything like that. That's really amazing. I'll be honest with you. When you first showed me the photos, I was like, oh my gosh, this is going to be a lot. But I knew, because we've done so many of these cases with you before, I knew what the final outcome could be like. So I wasn't at all worried, but the starting point, I was like, wow,
there's a few cases that we've done that would be cool to show people. We've done some transformations that have changed people's lives. The only problem with my brother is we're sitting here and we're talking, and my wife looked at me and said, you should do your teeth. I'm like, yeah, one filling in my head. No, I'm not. I don't want to do mine. Now she's getting on me. She wants me to fly out to see you guys and have your guy do my veneers for me.
Say the word, we can make it happen. But I will say a quote from one of the smartest minds in dentistry. There is no better dentistry than no dentistry. So yeah. I have 2 fillings.
Well put.
I can't take credit for that.
But apparently she says mine are dingy. I'll bleach them. But he's forever grateful, and thank you. Thank you very much. Without committing you to treating other people nice, I'm just going to tell everybody you treated me very nice in my brother's case. And
we're going to do the same for yours too, if time ever comes. But let's talk a little bit about scanning and intraoral scans. And you've used Impregum your whole life, maybe, or maybe not. At least as long as I've known you.
My total private dental career, yes.
Impregum.
I've tried a few other products that people have said, hey, try this, try that, and they can't get me off of the Impregum. And well, my good friend and my original partner from back 85 and 86, he's scanning. And you guys have even offered to, am I allowed to say that you even offered to try to get me one so I could scan?
Yeah.
It's just save shipping costs. I'm at that part of my career where, well, one thing, they're hard to get. But
right.
Don't know that I am on my, the sunset's about ready to set. So I'm having fun. Things are just easy. They're just so easy right now that not trying to learn. I know somebody's going to look and say, "Oh my God, you're a dinosaur." You're still taking impressions.
It's about being predictable and what works in your hands. So again, and we have tons of customers that still send us physical impressions. But tell us a little bit about your rationale for Impregum. How you tell us about the way you isolate your margins and everything. Just because your wisdom can help hundreds of our customers and hundreds of people on Dental Up listening right now.
I'm not sure about that, but no, I just when we're doing the prep, I try to do the prep. I give you a nice little shoulder all the way around. I would think I use the electrosurge tip, which is cheap man's laser, instead of packing cord. It just worked very well for me. I get beautiful hemostasis. The impressions are clean. I usually will take the Impregum impression and then reload it with another thin layer. Put one little tiny drop in each prep. Replace the impression into the mouth for another 4 minutes. Then you take it out. They're just such a beautiful collar all the way around, and you guys nail it. I mean, it's just
when was the last, when have I ever had to call you and say, sorry, this is distorted, or I can't read margins? I mean,
I can't remember.
Yeah, 25 years. I can't remember.
Yeah, I don't think we've ever had that.
Right.
I have called you ahead of time a couple of times and said, Bob, don't judge me on this one. But
and I don't. But you know what? See but here we are being honest with each other. Even when I get that Impregum that you think is not great, what's the final result? I mean, we're able to work with it, and it fits. So
and it's just a difficult patient, someone with special needs or something that it's just hard to get it done and take the time. Well, you always take the time, but to get it exactly how I would like it, sometimes there's compromises that you have to make, or a crown that just so hard to get to or whatever, and you would just say, how did we get on that subject? That sounds horrible.
That's okay. That's why there's editing. It's all good. Okay, so I mean, do you want to wrap this up with how you're transitioning now?
It's been a beautiful career. I've been blessed to open up in just a wonderful area with extremely nice patients and great patients. I've been fortunate enough to keep my staff together forever. I have 9 employees. 3 of them have been with me over 30 years, 3 over 20, and the shortest tenure I have is 2 at 15.
That's success.
I've had 2 incredible laboratories. You guys are unbelievable for all of my crown and bridge. It's made my life easy. I'm spoiled. I'm absolutely spoiled. I can pick up a phone and call you and talk to you and get almost anything I need done, whether it's rushing a case or making things you guys do, like making a crown fit under a partial. And it just baffles me with the precision that I get stuff back. It's like the harder the case, the better the outcome. It's crazy. I use a local lab for my dentures and partials and repairs and stuff, only because stuff has to be done same day. And I tried to get you guys into coming to Florida, but I can't get Sean to move. Although you did stay at the Common. But no, I've been blessed, and you guys have been a major, major, major part of that journey. And I am, I am coming to the end.
Yeah. Well, no, but thank you. I mean, but that, ladies and gentlemen, is a successful career. You've connected with your patients. You've maintained your staff for an unbelievable amount of time. I mean, that little turnover. I mean, I remember back in 2000, and I would call, and Paula and Debbie would answer the phone, and they would go get you.
Got the same 2 people.
Yeah. I mean, but that's success right there. That's success. And you'll give me a patient name, and I'll look it up in the computer, and we've done 16 teeth for these these patients, and they keep going back to you because, number one, they trust you, they love you, and that's a successful career.
And that's, and that reliability is right back at you. That's why I don't shop around. That's why do I ask for favors? Yeah. No. Like, can you get this back quickly? Can you do this? Can we try to do that? But I never, you guys have been phenomenal. And I thank you so much. I think you're a major portion of why whatever success I've had, you guys have been a major influence in it. And I really appreciate it.
Well, as do we. And again, this building, we wouldn't be here if it wasn't for you. I'm certainly convinced. And I know personally, for me, I'm lucky to have you as a friend and a mentor, because you've taught me many things over the past 25 years. And although I can't speak for Sean, I know that he considers you one of his closest friends as well.
That's good to hear. And I feel the same way about him. We've had some fun phone calls in the past, yes. And we've had some fun face to face when I flew out there. He does know how to treat his friends. It was a great trip.
Absolutely.
I appreciate you guys. I appreciate you guys a ton. Thank you.
Thank you. Be well. All the best. And we'll be in touch soon.
All right. Thank you.
Okay.
Bye-bye.
Thank you for listening to the Dental Up podcast, your daily source for insights from dentists and leaders in the industry. This episode is sponsored by Keating Dental Lab, here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.